Welcome. Thank you so much for coming. This is a bit of a short presentation to give you a bit of an introduction to breast cancer and exercise. It's being talked about a lot more and more, but I think it's still a little bit unknown, particularly for what you can and can't do after a diagnosis, and also before and after treatment and during as well. So it's not just about exercise. There are a number of different lifestyle changes that you can help make that are in your control that will help you live well during and after treatment. So I'm going to go through them today. It's a really informal presentation, so I feel very formal here. If you have any questions, please do stick them in the comments. I will do my best to answer them as we go through, or you can take yourself off mute and ask anything at any point. So, a little bit of an introduction. So, I'm Sarah. I don't think I've met any of you before, but I am a cancer and exercise specialist, and I started my company, Get Me Back, 2 years ago. After I myself had cancer. It was cervical cancer, diagnosed actually 3 years to the day yesterday. So just had my cancerversary, if you refer to it as that, and was always a real exerciser. I loved doing sport. It was my control and something that I tried so hard to keep up during my treatment. Unfortunately, mine was so intense, I didn't manage to do it all the way through. But it was a huge part of my recovery, and to this day still make sure that mentally and physically I stay strong, just to keep everything kind of going, as you might understand. So I started my company. I trained as a PT. I went on to then specialise in cancer, and I started working a lot with women who have had breast cancer, and those who are going through treatment and those who have finished treatment. So I took a wonderful course run by a physiotherapist to become a breast cancer rehab coach. So specialising in things like shoulder rehabilitation, making sure that I'm able to support those that have gone through reconstruction, or just rebuilding movement in areas that have been affected by surgery or treatment. So that is a little bit about me. I want to run through today some of the issues that you might be facing from a movement perspective, physically, but also mentally, challenges that you might need to overcome to move a little bit more, and exercises that you can do during and after treatment. And then also come up with some solutions to some of those issues. And it's really great that you can share experiences, perhaps even through comments through me, so that I can let you know that some of the things that you do experience are quite common and are experienced by a few other women as well. So there'll be time for questions at the end, but as I said, you can take yourself off mute and ask anything as we go. So I'm going to get cracking straight away on challenges. So if you can let me know the type of challenges that you're facing. So this could be mentally or physically, in terms of movement, and there can be obvious ones and not so obvious ones. So do have a type in. I'm going to see if I can find my comments here. And so a show of hands as to anyone who might have had problems with fatigue issues. Yep. Okay, just going to let in one more. Any issues with shoulder mobility? Yeah. Okay. Things like lymphedema. Any problems with lymphedema? Okay, that can be a massive limitation to movement. And I don't know from your point of view, but from my point of view, those things are managed to a certain point with healthcare professionals, but then it does get to a stage, perhaps, longer further after your diagnosis, where they're not addressed quite in the way that you need them to be. So based on your responses and some of the others that I see from my clients, those who have had surgery or treatment to an affected side experience shoulder issues, movement, posture, raising even to reach a cabinet above a certain level, People are having problems with lymphedema. It might limit them in terms of how they're moving that side, they're lifting a certain amount of weight. Weight management. This was something that massively shocked me through my treatment. I thought that would be, you know, I wouldn't be able to eat. It would be something that I'd really struggle with to actually keep my weight up, but it was complete opposite. I put on loads of weight and couldn't lose it. But from a mental health point of view, I lost my confidence. I mean, I don't know whether you guys feel like, you know, there was a massive issue with, you know, having to face my body that didn't work for me and let me down, and actually it was really difficult to regain that confidence in my own body. So just having a think about, you know, getting in touch with your own body, thinking about how those things might have affected you and might be preventing you from moving more. But one thing that I do see a lot, where's my slides gone? Sorry. There we go. Everything hurts. Everything hurts. So if you've been a little bit immobile for a while, you're really pain and stiff, and everything hurts. Aromatase inhibitors, tamoxifen, huge a contributor to this. And I see it a lot in my clients. They really struggle to get down onto the mat. They struggle to move. And this is something that comes up a lot. And it's due to the low estrogen levels that you have in your body. That massively affects the joints. It massively affects the hydration of the body. And therefore, it creates this kind of painful feeling like you're 90 years old type movement. And I want you to realise that you're not alone in feeling like this. There are a lot of women who have been through breast cancer who do feel like this, and there are solutions and strategies that you can use to help you in making this feel more manageable. So, fatigue, hot flushes, disturbed sleep, any of those things resonate with you? Certainly do with me as I'm going through menopause number 2. It is menopause induced, but also treatment induced fatigue as a result of radiotherapy, chemotherapy, hot flashes when you're asleep, waking you up in the night, massive disturbed sleep as a result of all of those things. And there are strategies that you probably know about that you can deal with some of these things. You may have heard of good sleep hygiene, things like making sure that you go to bed and you wake up at the same time each day. That can be very beneficial in just regulating your body clock, making sure that caffeine is reduced completely in the afternoon, particularly in the evening. And alcohol is something for me, definitely, that hot flash is just almost instant. As soon as I have a glass of wine, I'm straight into full-blown menopause. So making sure that you're using the right kind of sleep hygiene each day to help manage some of those symptoms. And also there are things like mindfulness and cognitive behavioural therapy that can help a little bit with disturbed sleep, managing some of perhaps the anxiety that come alongside a cancer diagnosis that might be keeping you subconsciously awake at night. But exercise, what we're here to talk about, is something that can hugely regulate hot flushes. It can just minimize them, reduce them down, and it's really beneficial at just keeping you at kind of that constant body temperature. And you know, rest is not always best. It's something that perhaps was pushed by doctors several years ago, but now is not the right solution for fatigue particularly, and cancer-related fatigue. Movement and activity is something that has a huge reduction on fatigue levels and improving energy levels. And it might seem a little bit counterintuitive, but it's hugely beneficial on your levels of fatigue. So there is good news, because there is a solution, and it's a new drug that helps you sleep better, move better. It manages your stress, it lowers your blood pressure, it helps keep your weight under control, it improves your heart and lung function, something we need to watch after chemotherapy, and it improves your energy. And as you've probably guessed, it's called exercise. And yes, that's me jumping in the air. But I know that sounds a little bit easy peasy, but it is a drug, really. It is something that we need to consider. That is, it should be part of our daily medical routine. Something that perhaps is neglected slightly, but can help you manage a lot of those challenges that we talked about at the beginning. But to caveat, like any medicine, we need the right type at the right time and the right dosage. And so particularly as you go through your treatment journey, those things will change, because you won't be able to do as much exercise during your treatment when you're feeling tireder. Even within a treatment cycle, there'll be times where you have more energy, you'll be able to do more, but then perhaps, you know, post-treatment, a week post-treatment, that will change. But particularly from my point of view, we need to consider the right type of exercise. So that for me is the most important thing. And that will be different for each different person, depending on the treatment that they've had. So things that we bear in mind from a movement perspective are things like lymph involvement. So if you've had nodes taken from your axilla, from your under your arm, that's something we need to consider in terms of weight bearing exercise, weight lifting, anything where you're static, so you're holding like a plank. I would advise against, because initially anyway, because you're putting pressure on the lymph system, on the lymphatic system, that's draining away the excess fluid from that area. So that's something that you just need to be aware of, a slow progression of weight lifting. So they tell you probably in the hospital that you shouldn't be carrying heavy shopping, because one, the bags are cutting into your hands, and two, you're holding something in a static position that is putting pressure on your lymphatic system. So that's something you just need to be really aware of, and a program that is designed by someone who is a specialist and understands the progression of the right type of exercise tends to be advisable, particularly when you're going through your treatment. So there are lots of other things that you should bear in mind that might not be obvious, and we're going to go through those in more detail, but one of those things is your pelvic health. And it might not have been something that you consider when you're being affected around this area, but your hormones have a huge impact on your pelvic floor, on stress incontinence, kind of anything in that pelvic region. So it's important that the pelvic floor and the breathing techniques are managed correctly during exercise, so that everything is working in sync all the way through the body, so that your bowel movements are correct, your pelvic floor is controlling, you know, your urinary incontinence and things like that. So just bearing all of those things in mind, and we can go through things like that in a little bit more detail, but those are just a few things that I wanted to mention at this stage. So bearing those things in mind. And it's daily. And I'm not saying you need to go to the gym and lift weights every single day. I'm saying some form of activity is a daily dose of the exercise and the activity that you need to be doing. And it's first thing in the morning is the easiest time to do this type of thing. I know not everybody is a morning person, but when you get up first thing, it's a great start to the day. I would do it outside. I work completely outside, apart from with my virtual clients, but I tend to try and persuade them to be outside, because the vitamin D and the rewards from a kind of mental health point of view is so beneficial. So getting outside, even putting on some earphones, listening to some music or an audiobook or something, getting outside and making sure that you do your 20-minute daily walk as a minimum activity each day, and see that as your drug prescription, and it's part of your treatment. So it's important that you prioritize the self-care and the exercise as a priority. And it has side effects, but they tend to be pretty good ones. So better sleep, fewer hot flashes and flushes, whichever way you decide to describe that, weight management, So it's keeping that weight under control, particularly when you're going through your treatment. But it also decreases the side effects of treatment. And I think this is a winner, reduces the risk of recurrence. That for me is like, is sold it basically, because weight management and exercise engagement are the two biggest predictors of living well and living longer after a breast cancer diagnosis. So that's actually been proved in clinical studies, and is a massive motivator, I think. And I think, you know, it's so easy to neglect self-care because there's so much going on in life, but the fact that this just reduces the risk of recurrence is something that is quite motivating anyway. Okay, so have a think about the type of exercise that you enjoy. And this is going to be very personal to you, but why do you feel held back from doing it now, or, you know, when you are feeling able to exercise, what's holding you back? Because these tend to be the reasons and some of the, you know, challenges that we talked about at the beginning. And I've put this in here because it gives you a little bit of a picture. So having a little bit of self-awareness of your own body and where you're feeling these barriers physically is quite a good place to start. So getting in tune with your body. For me, the biggest barrier was just feeling betrayed by my body. It had let me down, and I was a little bit angry with it, I suppose. And so I didn't look after it perhaps in the way that I needed to straight after treatment. But then there are some other barriers that you may have experienced, like pain, numbness, where you can't actually feel. I've got a lady who can't feel her tricep because she's had lymph nodes removed and it's affected her nerves in her triceps. Stiffness, like we talked about, from the aromatase inhibitors or tamoxifen or any of kind of the ongoing hormone therapy that you might be on. Swelling from lymphedema or post-surgery might prevent you from moving. Low energy, fatigue, just feeling generally down as a result of a cancer diagnosis. And pain, I mean, you don't want to be in pain when you exercise. You shouldn't be in pain when you exercise. So working out a solution to manage that. But for me, and the reason that I started this company was because I just didn't know where to start. I didn't know what I could and couldn't do. And so that was a massive barrier in me progressing through my exercise. So have a think about that, because that's quite personal. And if there are any particular issues that, you know, I can help or advise with, then let me know at the end. And I hope that we will be able to address some of them as we go through. So this is one of my clients. This is us outside in the summer in the not so cold weather. So we talked about the 20-minute daily walk. This is the perfect exercise foundation. So this is what you start with. If you're feeling a little bit low on energy to begin with, the best thing to begin with is that 20-minute walk. So that's the daily dose of the cardiovascular exercise that's going to help with the heart. It can be more than that if you want, but a minimum of a 20-minute walk a day. But that is not always enough, because there's a lot that's gone on in your body, and there's a lot that needs to also be looked after, especially as the hormone levels start to drop and the joints start to become stiffer and weaker, and perhaps are more susceptible to osteoporosis or osteopenia, which is the beginnings of osteoporosis. So there are other things like strength, balance, flexibility, restorative work with yoga, and things that you can do to calm the body. But in answer to this question, what else can I do? There are no limits, really. As long as you have the right guidance, I wouldn't stop anyone lifting weights. I wouldn't stop anyone doing HIIT training. I wouldn't stop anyone doing yoga or dancing, as long as they understood exactly what it is when they needed to stop, how they needed to progress, exercises that they should avoid as a result of their treatment. But I want people to know that they really genuinely can continue to exercise safely as long as they know just where their limits are. So, you know, getting out on your bike, a fantastic way of keeping up your cardiovascular fitness, because that can be compromised during your chemotherapy. It's really important that you maintain good heart health. Running, same. Playing sports, yes, brilliant, but make sure your joints are strong because they will be weaker after treatment. So make sure there's some strength work in there as well. Same goes if you like aerobics, you know, similar thing. Just be aware that your body is different to your pre-cancer self. Okay, and so you need to treat it with respect, and you need to make sure that you're looking after it, and that you're aware of what it's been through, because it won't necessarily immediately be able to do all the things that you used to do if you were fit and were doing other things. One key thing that is particularly important is strength training. So recommendations generally for any person, be it with or without cancer, is twice a week. And this can be anything, but it's something that is weight bearing or is working on joint and bone strength. So for ladies who have had a hormone-driven cancer or are on hormone suppressants, where their estrogen levels are dropping or are very, very low or zero, will have joint issues. They will be compromised from an osteoporosis point of view. And so it's really important that you maintain this strength training. And that can be so simple. You can garden, you can hoover, you can do things around the house, or if you like, you can do yoga and Pilates, weight-bearing exercises, where you're also doing some nice relaxation work as well. Bodyweight exercises cost absolutely nothing. Don't go planking, but squatting, sitting, getting in and out of a chair, really great at starting up with the leg strength, but also with the breathing, with the exercises, the pelvic health. That's a really good exercise. And you can use free weights, baked bean tins if you want. They are a fantastic way of arm strength building. I found that my arms, the steroids completely wasted some of the muscles in the arms, and that was a great way of rebuilding the strength in my biceps, triceps, in my upper back. And then another great piece of kit that costs near to nothing, I've got them down here, is a resistance band, so stretchy band. That is brilliant for shoulder mobility because you can buy them at different strengths and they can help you in just strengthening the upper back so that you can open up the chest again. So really great pieces of kit. So it doesn't have to be anything like, you know, lifting a big barbell with a lot of weight on it. Weight training can be anything from body weight to resistance bands to simple activities around the house like gardening or cleaning. So there are added benefits, and yes, I'm going to talk about toilet health because bowel health is a very important part of self-care. And when you exercise, it creates a much greater diversity in your gut biome. Bet you didn't know that, which in turn supports your immunity, something that has probably been compromised through your cancer treatment. And actually, exercise is the best solution for constipation. So if you have had surgery, anaesthetic is great at making you constipated. Treatment, something, reconstruction, a DIEP or a TRAM where you've had abdominal surgery and it could have affected a little bit around your bowel movements. Your 20-minute daily walk will really come into its own here and really give you that good gut health that you need, as well as the mental health and all the other benefits that we've talked about. But what happens is that you excrete your excess hormones through your bowel movements. So if you have a hormone-driven breast cancer, this is something that you want to happen regularly. You want the bowel movements to be good so that you're excreting all of those excess hormones and they're getting way out of the body. The other great benefit of good bowel movements is that it manages your lymphatic system really well. So you're getting rid of your excess fluid, your excess waste, and everything is running nice and smoothly. So your lymphatic system is basically your drainage system. And there are kind of lots of nodes around here, lots of nodes around your pelvis, like into your groin area. And those are the key areas that draw all of the fluid into the central lymphatic system and out of the body. And so if you've had some nodes taken from around here, you'll be a little bit compromised around this area. So everything needs to be drained nice and smoothly. So basically, exercise and that daily walk is a fantastic strategy to manage any kind of constipation issues that you might have, and you might not have been aware of that. So just to make you know that is something that's really, really important. So enough about bowel health. A little bit about self-care. And I know that I am an exercise professional, but exercise is part of self-care. So there are other ways that you can also put yourself first. So making time to exercise, that's key. But now is the time that you need to be really thinking about other ways that you can help yourself. So creating a new toolbox of self-care strategies after breast cancer. And they might be different to the things that you did before, and that's okay. We're going to talk about a little bit more about some of those things. But what I want to make clear here is that now is time to really start looking after yourself. And you might be doing it already, and that's fantastic. But I know as a mum and a wife and a woman that sometimes I don't put myself first. And after cancer, it's really important that you do. So lecture over. One of the key things that you can do, which is also very good for pelvic health exercises, is breathing. So simple, so simple, but breathing practice helps calm the nervous system. It helps improve your lymphatic system, and it helps with your pelvic health because your diaphragm and your pelvic floor work together. And so breathing is a key part of managing your core strength. Breathing when you're exercising is a really important management of when your core activates. So the widespread effects of deep breathing are particularly important. We breathe over 20,000 times a day, and I bet you're not aware of like very many of them. Well, I'm not anyway. So paying attention to your breath a little bit more is a really good start to your self-care routine. And just to teach you a very simple method of that, it's the alternate nostril breathing. So I put my hand or my finger on one nostril and I breathe deeply through my nose within that nostril. So you can really think about it. Exhale through my mouth while I switch my fingers to breathe through my other nostril and out through my mouth. So I do that probably for about 20 breaths, and then have a little breather, a break, where I'm not focusing on my breathing, and then maybe do it again if you can. So that's quite a nice thing to do, just to make you a little bit more mindful, a bit more aware, and just to calm all the breathing down if you're feeling a little bit anxious particularly. Other self-care strategies. So remember, I was taught by a physiotherapist, so they can also help you in this management strategy as well. And I have a basic understanding of it, enough to be able to demonstrate it. But I would advise that you see kind of a massage professional or a physiotherapist to do some of the scar tissue manipulation if you need it, but you can do it on yourself. So it's really important that you look after your scar. You may have found that through surgery things can tighten, and that in turn can affect your posture and therefore your movement and your shoulder mobility and all of those things. So from my point of view, looking after your scar is really important, and you can do that very simply with your thumbs, basically pushing and pulling, alternating across the scar once it's healed, just to keep the scar tissue breaking down and the fascia underneath nice and smooth, to help you have the increased mobility in the arm that you need. Number 2 is manual lymphatic drainage. And there are actual specialists around who can support in this as well, but you can do it yourself. So like I mentioned, if you imagine the trunk of the body is divided into quarters. So you have a line down the middle and a line kind of under the boobs, and each quadrant has its own lymphatic drainage system that comes into the middle. So if you are affected on one quarter, what you want to do is basically very slowly just massage across the chest into the unaffected area. So if you're feeling any kind of swelling, or just for a nice kind of massage, you're basically just very slowly pushing and manipulating the lymph to come across the body into the area that isn't affected to help with the drainage. And so this, I'd note, this is for people who have had lymph involvement in their cancer or had lymph nodes removed for investigation, just to support that movement of the lymph. Anything feeling a little bit hot and swollen should be reported to your oncology team. But that is a nice helpful way of your own manual lymphatic drainage. And we talked about prioritizing sleep. Really, really important for recovery, stress, relaxation, and hydration. So making sure that you're getting enough water. Anyone who had radiotherapy will know that it's a massive dehydrator. So important to keep drinking the 2 litres plus a day. And that in turn will help manage good bowel health, all of the other things that we talked about that are key for your own self-care. And finally, making good food choices. Now, I know that this is a hard thing to do when you feel tired and when you're not feeling yourself, but here's a little bit of help. What are good food choices? I mean, most people know that green things are good, and green things are generally pretty good, particularly green leafy veg, so cruciferous veg, broccoli, anything that is kind of rich in iron and is good from a fibre point of view, but is also good from a phytoestrogen point of view. So it's not an estrogen, it's a mimic of estrogen, not impacting the cancer, just to note, but it will help manage some of those side effects of menopause. Things to avoid, processed meats, just not the greatest. So the sausages and yeah, any of the more processed side of meats, and also just processed foods with lots of sugar in. I would advise white meat and fish are the best. If you are eating meat and fish, are probably the best source of protein from a more meat-based diet, meat and fish-based diet. But if you think plant-based is your focus, so you want fruit and vegetables, lots and lots of vegetables with everything, and there's a pint of beer on there. We talked about how alcohol can impact menopausal symptoms, but it's also like an estrogenic, so it's a bit of a manipulator for estrogen. So we want to avoid it as much as we can. So it's really important that you take pleasure in what you eat, and I wouldn't want to ever deny anyone that, because I love my food, and just take enjoyment in cooking it and cooking it fresh. So the key message here is you want to be eating a wide and varied diet that's heavily plant-based, but is also supported by good hydration, lots of water, but enjoyment is a must. So make sure you enjoy what you're eating, but just be mindful of what you're putting in your mouth. And finally, so you deserve to thrive, and you totally do. And I know that it is a massive journey, and those of you who are on ongoing treatment, it's an even longer journey. But movement should definitely be part of that, in helping you feel as good as you can, and minimizing a lot of the issues that we talked about at the start. So I hope that through some of the recommendations that I've made, that helps you feel a little bit more confident in movement, but also that you'll take on some of the self-care advice that I've provided, which should sit alongside a movement program, as well as the nutrition. So just making sure that you're eating nice healthy foods to look after your body. And remember, it has been through a massive amount. And so, you know, I am slowly becoming proud of my body. But, you know, just look after yourself is my key message, definitely. And so just to finish, I run 8-week courses. So I do a series of fitness classes and online guidance. This is all online unless I can find enough people who are locally and fancy coming to my base near the Marsden. But we'll look here at breathing technique. We'll look at shoulder mobility and postural changes after your surgery and radiotherapy, strengthening of pelvic and core muscles, which is what I talked about at the start, but then general full body strength, cardiovascular fitness, flexibility and balance, but then also pick up on some of that self-care as well. So I do 2 fitness classes a week for 8 weeks and a stretch class at the weekend to cover the flexibility and balance. And the group all have their own supporting closed Facebook group, which means you can interact with each other. I post lots of advice and things on there. So it is a great way of just spending a bit of time rehabilitating yourself, but also, you know, being tutored by hopefully someone who is guiding you in the right direction after the treatment that you've been through. So if you have any questions or you want to talk to me about the course, then please do get in touch. I'm going to take the shares screen off in a minute so that we can interact and ask questions. I'm sorry that I haven't been able to see everything and everyone while I present. So if you know